Good morning, everybody. Thank you very much for joining us for our press briefing. We've got some exciting things we're going to be talking about today with regard to our Developing Youth Talent Initiative, but also a couple of new ways that Nebraskans can help participate in the fight against coronavirus. As always, we want to remind people about following our social distancing guidelines, the whole stay 6 feet apart. In fact, Wason and Jason, you guys are a little close over there. Maybe you should spread out a little bit. All right. We're wearing masks, so that's okay. But again, that social distancing, keeping 6 feet apart between you and other people when you're out in public, wearing a mask when you cannot do that. So if you're going to the store, wear a mask. Washing your hands often for 20 seconds at a time or using hand sanitizer, do that often. And then, of course, if you see a crowded restaurant or bar, it's a good opportunity to pick a different restaurant or bar. And with the increasing cases and hospitalizations we've had, it's a good reminder for everybody to continue to practice this. The virus is still in our community, and we got to continue to manage this virus, which means we need to continue to practice our social distancing guidelines. And of course, all the things that we've done, the restrictions we put in place, these social distancing guidelines have all been about protecting our hospital capacity. So as of yesterday, we had 38% of our hospital beds available, 39% of our ICU beds available, and 79% of our ventilators available. So we've been able to preserve our hospital capacity and have lots of capacity to be able to serve anybody who needs that acute care. And that's another important thing as we look at the increased hospitalizations, where we're up to about 153 hospitalizations. We need to just remember, we've put that in perspective of we've got 4,000 hospital beds in the state. We've got lots of capacity to be able to accommodate people. So really the coronavirus cases are only taking up less than 4% of our hospital beds, less than 4% of our ventilators. We've got lots of capacity there to be able to provide that acute care. We want to continue to do that, so please continue to remember to follow our social distancing guidelines. Also, I know that the legislature's in session, obviously, and they passed out of committee, the Revenue Committee yesterday, the compromise property tax incentives bill. I want to congratulate again the legislature for getting that bill out, the Revenue Committee. I want to especially congratulate Speaker Scheer for his great work to pull people together and do that compromise. So congratulations to the legislature. We look forward to continuing to work with them to get that bill so that we can get to my desk and deliver that much needed property tax relief to the taxpayers in Nebraska, renew our incentives program, be able to place ourselves well to be able to get the next project at UNMC and so forth. So all good news on that standpoint. Also, I know at the federal level, the legislature, or the Congress is working on giving us flexibility here at the state level with regard to our CARES Act money. While we're not asking for more money here in Nebraska, we will manage with our budget the way we have. In fact, we ended the fiscal year by putting $10 million into our cash reserve. We will continue to manage our budget. Bless you back there, Tony. Hope you're wearing that mask. Again, encourage Congress to be able to give us the flexibility with the money they've already given us to be able to use that here, maybe past December 30th, or use it for other purposes, and they've already outlined with regard to our state budget. Okay, so we got that. Also, one of the ways that people can participate in fighting against the coronavirus is testnebraska.com. We've got over 270,000 people signed up for that. Please, if you haven't signed up, please sign up for testnebraska.com. Everybody's eligible to start looking for scheduling slots. We're increasing those slot capacity, especially in Omaha. We've expanded the slots to 1,600 at the Crossroads. We've opened up a new site at Oakview Mall. We'll be looking to expand that up to 1,600 test slots. So lots of opportunities for people to get tested. We're doing testing 5 days a week here in Lincoln. We're working with healthcare providers across the state to provide testing days. So please sign up for testnebraska.com. And actually yesterday, Monday, we had 3,594 test swabs done. And then yesterday we had a new record of 3,822 test swabs done. So some big days for getting people swabbed for testnebraska.com. So next, I'd like to get into our Developing Youth Talent Initiative. So this is a program that we launched in conjunction with the legislature back in 2015 to really start that talent pipeline here in Nebraska. So pre-pandemic, one of the biggest issues we had was a workforce shortage. And so what we're doing is creating that talent pipeline, really starting in 7th and 8th grade, which is where the Developing Youth Talent Initiative is focused, and creating that pipeline through a career academy in high school, then post-secondary education, either a youth registered apprenticeship program or a registered apprenticeship program through the Department of Labor, or community college, getting a 2-year program, or going to one of our 4-year institutions. But continuing that, and then of course, taking up a great career in either manufacturing or IT. Now, the Developing Youth Talent Initiative started with focusing on manufacturing and IT, but we've also since expanded it to include engineering and healthcare. And so what we do is we look to foster relationships between private companies and school districts to give kids some real-world experience about what those careers look like, starting early in 7th and 8th grade. And it's been wonderfully successful to be able to get more of those 7th and 8th graders, for example, to take the skilled and science, technical science classes when they get to high school, taking that career academy. For example, in Hastings, we saw a 15% increase in the number of 9th graders taking those classes. We saw more kids getting interested in manufacturing. We also found from some of the survey work that the young people can talk to their parents about the importance of careers in manufacturing and educate them as well. So really some great benefits out of starting this talent pipeline with the Developing Youth Talent Initiative. We have $250,000 in grants every year that we award to schools and different companies. And throughout the program so far, we've impacted 43 school districts and about 12,000 students. And this year, we have 3 new award winners, 3 great companies that are located here in Nebraska that I'm very pleased to be able to talk about that will help us actually expand that even more to another 11,300 students. So, and we've got representatives from here, and one of them is going to speak. So first of all, we'll start with Klaas, German manufacturing firm located in Omaha, is going to be creating a program. They're going to get $92,300 to be able to work with 5 middle schools in Omaha, primarily North Omaha, so that they will work with the Partnership for Kids and an after-school program that will target low-income kids and kids of color to be able to get exposed to the kind of career opportunities and how you create that career pathway, again, starting in 7th and 8th grade, then going on to career academies and so forth, getting that post-secondary education to be able to take those jobs that we've got so many available here in our state. So from Nucor, we've got Alex Pompa. So Alex, thank you very much for being here today. And then our second company that is getting an award is Nucor, the Nucor Detailing Center. Now, Nucor is actually, this is their second award. This award they'll be working with 15 school districts and 15 schools, impacting about 2,000 kids. And additive manufacturing is one of the things they're going to be doing, which is another fancy term for 3D printing. So they're going to be purchasing 3D printers for 5 Norfolk middle schools, or schools in Norfolk area, to be able to help with that. They're going to be getting a grant of $40,400 to be able to work with those school districts, again, around additive manufacturing. And certainly during this pandemic, that's come in handy as the schools were able to pull together their 3D printers and be able to print those plastic face masks. So great work there, and David D. Corolis is here to be able to, or is representing Nucor on that. So again, congratulations to Nucor. And then our final award winner is Kawasaki here in Lincoln. And this is our first Lincoln company, so we're very excited to have Jason Hellebush here to be able to talk about that. So Jason is going to be talking to us more about what Kawasaki's program is, but it really revolves around, again, the same sort of thing. You're going to be working with one school district, but we've got 12 schools and about 9,000 students to be able to help get them introduced. And you've already had people from Lincoln Public Schools at your facility already working on what that curriculum would look like, again, around that skilled and technical science career path. So with that, Jason, I'm going to ask you to come up and talk a little bit more about that. You're getting $117,300 for this grant award. And tell us a little bit more about how you're going to be working with Lincoln Public Schools to create those career opportunities for our young people.
Thank you, Governor. Good morning, everyone. As the Governor said, my name is Jason Hellebush, and I'm the Director of Administration at Kawasaki. First and foremost, I'd like to thank Governor Ricketts and all others involved with the Developing Youth Talent Initiative. We're extremely excited to receive this grant and about the opportunities that it's going to provide. Kawasaki is continually looking for ways to strengthen our relationship with educators and students. Each year, we open our doors to over 1,000 students so that they can see firsthand the processes and technology that make our great products. Many Kawasaki team members regularly visit classrooms as subject matter experts, And whenever possible, Kawasaki supplies materials and equipment to skilled and technical science classrooms in the area. The Developing Youth Talent Initiative grant will allow Kawasaki and Lincoln Public Schools to build an unmatched industrial technology experience for middle school students in Lincoln. With this generous grant and Kawasaki's commitment, students in Lincoln will benefit from a hands-on experience with state-of-the-art technologies such as welding simulators and 3D printers. They'll also learn about computer-aided design, drafting, and engineering, as well as have the opportunity to work with Kawasaki general-purpose engines. Our goal is to introduce young people to career opportunities in manufacturing that develop a strong recruiting pipeline for manufacturers such as ourselves and others in Nebraska. Thank you all again for this opportunity. We're excited with what the future will provide. Thank you.
Great, thank you very much, Jason. Kawasaki, again, congratulations on the grant program. And Kawasaki is just a great partner here in the city of Lincoln, as are Nucor and Claas as well. But we really appreciate the work that you're doing there to be able to help us out. And in fact, one of the things when we launched our Lean Six Sigma program at the state, Kawasaki showed us what they were doing as far as their process improvement in Lean Six Sigma to be able to help educate our cabinet on it. So great. But again, congratulations to Kawasaki, congratulations to Nucor, congratulations to Claas. So next, I want to talk about a couple of other things that allow Nebraskans to be able to participate in this fight against the coronavirus. One of the things that we have discovered, or I say we, the science community, the CDC, has discovered is that if you've been infected with coronavirus and have recovered, that you've got those antibodies in your blood plasma. And donating that plasma can help somebody else who is trying to recover from coronavirus be able to do that, help their convalescence. And so you can find out more about this from the Red Cross directly. It's redcrossblood.org, right? That's the name of your website. And today we have Wason Dunn from the American Red Cross here in Nebraska to be able to talk a little bit more about that program and how Nebraskans can help make sure that other people can recover from coronavirus. So Wason, will you please come up and talk about that?
Thank you, Governor Ricketts, for inviting me here today and for your continued support of the American Red Cross. We are currently looking at a national shortage of convalescent plasma, which is something that has been shown to be able to possibly help people who are severely ill with COVID-19. Convalescent plasma has historically been used over the years in instances where a new infectious disease develops so quickly that there are no known treatments and no vaccines available. Convalescent plasma is collected from individuals who have already withstood and recovered from the infection, and therefore, as Governor Ricketts noted, they have antibodies which can help fight that infection. And in this case, we're talking about COVID-19. Research, as well as actual clinical use in recent days, has shown that convalescent plasma has potential to significantly help those who are seriously ill with COVID-19. The American Red Cross has seen the demand for convalescent plasma more than doubled in the past month as the number of coronavirus cases continues to increase in our country. As a result, there is now a shortage, and we are distributing more convalescent plasma products than we are receiving in donations. So to try to remedy this shortage, the American Red Cross is partnering with the United States Food and Drug Administration, the healthcare industry, and also our biomedical services industry partners to conduct a coordinated and collaborative effort to collect convalescent plasma around the country. The Red Cross is collecting convalescent plasma at more than 170 locations around the nation. And here in Nebraska, we are collecting convalescent plasma at Red Cross facilities in Omaha, Grand Island, and North Platte. Since March, or early April, actually, since early April, thousands of people who have recovered from COVID-19 have rolled up their sleeves to help others who are suffering from the disease by donating convalescent plasma. The Red Cross has already distributed more than 24,000 convalescent plasma products, and it's important to note that one single plasma donation can potentially help up to 3 COVID-19 patients. So the Red Cross is now looking for people who have fully recovered from COVID-19 who want to help others by donating their plasma. In order to be eligible to do this, you have to be 17 years old, you have to weigh at least 110 pounds, you have to be currently healthy and generally feeling well, and most importantly, you have to have recovered from a confirmed case of COVID-19, and you have to have been symptom-free for 14 days. So if you meet these criteria and you're interested in helping others who are suffering from COVID-19, we encourage you to go to the Red Cross website, redcrossblood.org/plasma for COVID, and the 4 is the numeral 4. So I'll repeat that a couple of times. It's redcrossblood.org/plasma for COVID. On that site, you will complete an application form and then subsequently be contacted by somebody from the American Red Cross who will do a very thorough screening to make sure you're eligible, and if you are, an appointment will be scheduled. It's important to note that we cannot take walk-in plasma donations. People must have an appointment and must be thoroughly screened because of the complexities involved. So if you're interested in helping, again, go to redcrossblood.org/plasma for COVID. You know, last April, we were looking at a serious shortage of regular blood products because of the fact that so many blood drives have been canceled due to COVID-19. As a result of Governor Ricketts' call to action, Nebraskans really stepped up, and I'm pleased to be able to tell everybody here today that because of all the donations we were able to receive here in Nebraska, we helped prevent a potentially serious healthcare crisis and blood shortage both in our state as well as around the country. So now, if people are interested in helping, particularly during this trying time of continuing COVID-19 health emergency, I would encourage you to remember we're all in this together. We need to help each other out and consider donating convalescent plasma. I do have a one-page flyer that I can leave with the media representatives that are here today that have more details that they want, as well as have the website on there. So thank you very much, Governor Ricketts. Thank you for having me here today.
Great, thank you very much, Wason. That's, again, a great program to be able to help people who have been infected with that convalescent plasma as one of the treatments. So please, if you fit the categories, the criteria that Wason was talking about, please check out the Red Cross's website to be able to donate that plasma. Also, actually, before I move on to the next thing Nebraskans do, I realize I forgot to mention that Tony Goins, our Director of Economic Development, is here in the room, and I want to compliment him and his team, as well as the team from the Department of Labor for their work on the Developing Youth Talent Initiative. That's who works together to be able to select the companies who are the grant award winners. So thank you, Tony, for being here. I appreciate it, and Dan Curran as well, right? So thank you very much, both of you, for being here, and thanks for all your hard work. Now, another way that Nebraskans can participate in fighting against the spread of the coronavirus has to do with developing a vaccine. As you may have heard, the White House has an operation called Operation Warp Speed. It's working with a number of different companies to be able to create a vaccine to be able to help make sure that we prevent the spread of coronavirus by getting vaccinated against it, just like we do for so many other diseases. And they are now looking for people to participate in clinical trials. And so if you have an interest in helping fight the spread of coronavirus, helping to beat this virus by participating in one of those clinical trials, you can go to www.coronaviruspreventionnetwork.org, coronaviruspreventionnetwork.org, that website, and that will give you information about how you can sign up for a clinical trial. I know that the University of Nebraska Medical Center has been heavily involved in treatments and vaccination programs and so forth. This is a way for Nebraskans, every Nebraskan, to be able to take a look to see if they would be able to participate in one of those vaccine trials. Coronaviruspreventionnetwork.org, another way to help fight. So we got two new ways today, convalescent blood plasma donations, so that plasma donation, if you've been infected and you've got those antibodies, and 2, signing up for the vaccine programs to be one of those clinical trial people. All right. Next, we have our upcoming schedule. Our next scheduled press briefing will be on Monday, and we'll have another back-to-school briefing. This time we'll be talking with folks who are in the private colleges and the state college system. And with that, I think we're, again, that'll be 10 a.m. right here in this room on Monday. So back to school with private colleges and state colleges. And with that, I think we'll go ahead and open up questions and answers. Taylor, do we have any that were texted in?
No questions.
We had no questions texted in, so we'll just start with folks in the room. Paul? Paul, you know, you're always good to start, so why don't we start with you?
I'm willing to do that. So, some people suggest the way you could help stem the spread was we allow Omaha to do a mask mandate. And we found out that it's the largest city in the United States that doesn't have a mask mandate. Do you think a mandate would help deal with the current spike in cases there? And what would you respond to Senator Hunt's comment that it's an embarrassment that we aren't allowing a mask mandate to happen?
So the question was about mask mandates, specifically about Omaha, and, you know, should we allow Omaha to have a mask mandate? So here in Nebraska, we have always put together a plan that was right for Nebraska. So for example, other states did stay-at-home orders or shelter-in-place orders. We didn't do that here in Nebraska. We were one of the few states that didn't. What we did do is a campaign to stay home, stay healthy, stay connected, where we asked Nebraskans to stay home while we were flattening the curve. And guess what? It worked. We were able to do that, and we preserved our hospital system, which was what this has all been about all along. Masks are another tool. We talk about it in all my press briefings. Wear a mask when you go to the store. Masks are another tool we want people to adopt as part of their everyday life. And so we want people to get used to, this is one of the things you do when you're going to be inside and you can't be social distancing, you can't keep 6 feet away from somebody, you're going to be closer than 6 feet, wear a mask. That's a way to prevent the spread of the virus. At the end of the day, the virus is spread from one person to another, so if you're going to be closer to another person, wear that mask. The approach we've taken here in Nebraska is to ask people to do the right thing, relying upon their personal responsibility and civic duty to be able to do that. And not have the government come in and say, this is what you have to do. And I think that by doing that, by asking Nebraskans to do the right thing, they're civic-minded, they will do the right thing. And so we want people to adopt this as a compliance thing, as a voluntary thing, as a part of their day, everyday life of how they do this. Because at the end of the day, we don't have enough police to go out and write tickets for everybody who's not wearing a mask, and the police don't want to do that. What we want is people to voluntarily adopt this. And, you know, think about maybe when you're working with your teenagers. Sometimes it's more successful to explain to them why they should be doing something and ask for their compliance rather than to tell them what to do and have that resistance. So I think by asking Nebraskans to do the right thing, we'll get more compliance, and we won't meet as much resistance as if we actually had the big, heavy-handed government telling them what to do. Now, specifically with regard to Omaha being one of the cities that hasn't done this, you know, again, part of the plan that makes Nebraska unique. Nebraska is also unique in that we have a unicameral form of government. We're the only state that has that. But I presume Senator Hunt isn't presuming we should get rid of the unicameral because that's unique as well. So we do things here in Nebraska to fit a Nebraska plan, and that's part of why we're asking people to use masks in the appropriate situations, and that's what we're going to continue to do.
Sure, I mean, there's not enough police to go out, but, you know, it's like a speed limit. We don't have enough police to check everybody and make sure they're driving under 70 or 75 or whatever. Isn't it the same thing? If you pass a law, then people feel obliged to wear a mask. They don't feel like, well, it's up to my choice. Wouldn't it increase the use of masks if you made it a mandate?
So the question is, would it increase the use of masks to make it a mandate? And actually, that's what I was just explaining. I actually don't think it would. I think you'd meet more resistance. And I think what we need is, again, this is a virus that's in our community, and it's going to be here for a while. There may never be a vaccine. So if you put a mandate in, does that mean that and we never get a vaccine, that you're going to make people, you know, mandate that it's a crime to not wear a mask forever? I think what we have to do is have people understand what the appropriate use of a mask is and rely on their common sense and good judgment to do that. And that's the approach we've taken from the state. And folks, we've been successful. You know, and I went over all the hospital data here earlier. All this is about making sure we preserve our hospital capacity, and we've done that. So we've been successful taking the Nebraska way to approach this, and that's what we'll continue to do.
Can you comment on the grand compromise? I know over and over you said we need some more controls on spending by schools, and now that's not part of the deal. Can you comment?
Sure. So Paul's switching gears on us a little bit here. He's talking now about the legislative property tax incentive compromise that came out of committee yesterday. And it does not involve expense controls for local government or schools. And just my thoughts on that. You know, as with many compromises, everybody got something, but not everybody got everything. So I think it just represents a compromise that the speaker was able to craft with his members to be able to provide people with some of what they wanted, but not everybody, you know, I don't think there's anybody who got everything they wanted. So I think it represents a compromise, and it represents a step forward, and that's why I think it's great that the legislature was able to get that done and be able to start taking us forward to provide that much-needed property tax relief for the citizens of Nebraska. And I look forward to continuing to working with them to be able to get this to my desk.
Philosophically, do you think tax incentives work to increase jobs?
So the question was, philosophically, do I think tax incentives work to increase jobs? The way I think about tax incentives is kind of the way I think about when we did marketing back when I was in the business world. We would have an offer, say, open up an account with us and you get 10 trades for free. And what that would do is that would attract people to take a look at us. Now, what we want to do is sell them on our level of service and the quality of our execution of trades, for example, and the tools that we provide them to help make investment decisions and so forth. That's what we wanted to sell customers on, but we wanted to get to take a look at us by offering that free trade. Incentives are the same thing. It's a way to get companies to take a look at the state of Nebraska. When we get them to take a look at us, what we want to sell them on is all the great things we have to offer here in the state. Our super high quality workforce, the fact that Nebraskans are dedicated and loyal and well-educated and customer service oriented. You couldn't ask for a better workforce than you got here in Nebraska. Talk about our business-friendly environment, the fact that the state of Nebraska is working to make sure that we're customer-friendly to everybody who does business with us. So those are the sorts of things that we want to really sell about our state to get companies to come here. But those incentive programs are really what gets companies to take a look at us so that we can actually have that chance to make the sales pitch, to have the conversation. A lot of times when you have these consulting firms that work with companies on site selection, they're going to be looking to have an incentive program, and if they don't see an incentive program, you don't even make the list of states they consider to even bring up to those companies they're advising. So we want to have an incentive program that allows us to be able to get the attention of companies, but we don't want to buy the business by just giving everything away. We want to earn it by having a great quality workforce, a business-friendly environment, low-cost public utilities, great central location, great transportation hub, you name it, all the wonderful advantages we have here in Nebraska.
What about the aid that they would be providing to a company to not locate here, but to not move away? That's a brand new thing. Typically, we've rewarded companies if they expand jobs, expand their plant. This one, we're giving them money just to not move away.
So as part of the incentive package, there is a provision to retain a company here, and you're right, that is a new provision to do a retention program.
Philosophically okay with that?
You know what, I think that we can try the retention program and see how it works. We've got to be competitive with other states. We know that other states are offering incentive packages and talking about all the advantages they have. And so again, if we want to be competitive and hold on to those jobs, I think it's important for us to do that. And we can work on this package, and if we think we like it, we can maybe do more in the future. If we don't, then we can discontinue it.
So you want to wait and see?
Well, I think it's an important thing to have as part of this package to be able to retain the jobs here in our state. We're talking about 5,000 jobs in our state. That's a big deal. So I think we should have it in the package. I support it 100%. And then, but again, this kind of thing is, this is new, and if we decide to change our minds in the future, we can always certainly change our minds.
We have a question from John Walton. As schools open, increasing the likelihood of more spread of coronavirus, do you plan to consider taking new action to address that potential challenge?
So Don Walton says, as we continue to have coronavirus here in our state and the schools open, are the things that we're going to do to address that. I guess actually, one of the reasons why we're ramping up the capacity at testnebraska.com in anticipation of not just K through 12 schools, but our institutions of higher education having more kids back in the classrooms, why we're ramping up our contact tracing. And then, of course, we continue to support our schools and the plans they're putting together. Earlier this week, we highlighted Dr. Grover's plan for Grand Island and how thoughtful she has been with regard to crafting that plan to give parents options on remote learning, to do hybrid learning, to have in-classroom learning, and when she's got kids in the classroom doing things like having them wear masks, doing the temperature checks, cohorting kids, all the things that she did in her plan to be able to help address this. So, and as we also discussed, what we'll do is just have protocols in place so that if a child does test positive, that we will make sure that we'll take the appropriate steps, whether or not other people need to be quarantined, and again, it'll depend on the case-by-case basis. And I think it's also important to remember that there are other reasons why we want to have kids in schools, right? First of all, academic progression, right? We want kids to learn. And that means that some kids are going to learn well in remote learning, and some kids are not. And so we want to make sure that every kid has the opportunity to get that best education. We also know that schools help promote physical activity and physical well-being, that they promote mental health care and mental well-being, socialization. And as we discussed on Monday as well, some of the data from the CDC about, especially when we're talking about high schoolers, increased suicides that are higher than what we're experiencing with coronavirus deaths. Increased drug abuse deaths, drug overdoses that are higher than the background and higher than coronavirus. So there's other costs to not having kids in schools that we've got to be mindful of as well. So we want to look at the entire well-being of the child when we're making these decisions, and we'll continue to work with school districts on how we address it. Andrew.
What do you say to those people that are concerned about, the grand compromise package that commits us to some huge spending, down the road? How confident are you that we can meet some of those, the price tag, the balloon payment on it?
Right, so the question was, what about the dollars that would be needed to be able to fulfill the obligations for property tax relief? And we just have to manage the budget just like we manage all of our other expenses. When people are trying to increase, for example, spending on this program or that program, they don't worry about the revenue growth being available for that, so they shouldn't be worried about then the revenue available to be able to do tax relief either. It's just one of the things that we'll have to prioritize in our budget, that we'll manage within our budget. We've demonstrated over the last 5.5 years, our ability to work with the legislature to be able to do that. So I'm confident that we'll be able to do that. And in the way the bill is written, we actually have flexibility with regard to that. The first year starts at $125 million, but the rest of the $250 million comes over a 4-year period as the dollars are available. So we will work to be able to do that. And again, I'm very confident we're going to be able to manage this all within our budget and all with existing revenues that are growing. Yeah. Brandon.
Just to clarify, did I
Or
understand
Lee.
correctly that you believe the mask mandate would be less beneficial to people wearing masks than just voluntary action?
Yeah, I think the best way to get people to adopt using masks is by asking them to do the right things, similar to what we did when we asked people to stay home, and then a mandate would actually encourage resistance, and that would actually reduce people using the masks.
Then a follow-up to that, in regards to the chart that has been circulating with the 50 largest cities here in the U.S. and Omaha being the only one that doesn't have that mandate, why would you believe the other 49 go ahead and have that mandate, whereas Omaha would not?
Well, again, we've always done things the Nebraska way here. We're the only state, 1 out of 50, that has a unicameral. So we do things differently here in Nebraska, and we've been successful doing it.
But the unicameral is different than a mask mandate in that a mask mandate is preventative to health measures.
Well, we're not telling people, with regard to, so what Lee's asking as well, but a unicameral mask mandate, the analogy I'm drawing there is that we do things differently in Nebraska. We're unique. And we put together a plan that's right for Nebraska, and we've asked Nebraskans to do the right thing, and they've done it. I'm not commenting on what other cities or other states have to do, but here in Nebraska, we've taken a different approach, and we've been very successful. We've been able to preserve our hospital capacity. So we're going to continue to follow that plan.
The leading experts at UNMC that you've talked with, I'm guessing more than enough to know that the mask is effective. It just seems kind of confusing to agree with them on
So the question was about masks and, folks at UNMC saying it's an effective tool, and I agree with them on that. So we don't have a disagreement on that masks are important to be able to slow the spread of the virus, but it's a policy decision about how you actually implement that. And that's the difference between the mandating masks and then seeking that voluntary compliance. And so as policymakers, we take the advice from advisors and then we translate it into policy, and the way that we're translating this in policy to be able to implement getting people to wear masks is by asking them to do the right thing and doing the education and communication and all that sort of thing that goes along with getting that voluntary compliance.
In Lincoln, have you been able to see that mask mandate in a beneficial manner in the spread, or is it something that you believe hasn't worked?
With regard to Lincoln in particular and their mask mandate, they just implemented that on July 20th, is my understanding. And with non-pharmaceutical interventions, you need at least 2 weeks to be able to see something. So we're going to need, a lot more time to see if it's made any difference at all. And of course, that's just one thing, one of the variables on there. So it may be very difficult to be able to pick that one thing out to know if it actually made a difference or not. But it's certainly too early right now to be able to know.
Say the University of Nebraska goes through with a mask mandate across all their campuses, is that something you would support?
So the question was, if the University of Nebraska mandates masks across their campuses, would I support that? And yes, again, as we've talked about, having K through 12 schools, we talked about Dr. Grover's plan to have the kids in Grand Island wear masks. I support that. University of Nebraska, I support that if they were to do that. Because again, they're the policymakers who are making that decision on how to implement the policy that they think is best for what they're trying to do.
But you don't see a difference between the state of Nebraska and a mandate, however, those clustered areas in schools having a mandate?
So again, the question is, what about the state of Nebraska? And again, folks, we've got 25 counties over the last 2 weeks that have had 0 cases. 0. So you want to take a one-size-fit-all answer of mandating masks for the entire state? See, that doesn't seem right to me. That's why we want to, if organizations or say a private company like say Walmart wants to ask their customers to wear masks coming in, I support that 100%. But I'm not going to have the big heavy-handed government come in and tell people what to do, especially if you did it statewide and you got 25 counties that haven't had a case in the last 2 weeks, right? So if, people like the University of Nebraska want to do it, I support that. And if other organizations are going to do it, they just have to do it within the scope of the law. Yeah, Paul.
Wouldn't the mayor of Omaha and the city and the county board and the county health department, wouldn't they be the policymakers in the Omaha area?
So the question was, who are the policymakers in the Omaha area? And they are free to pursue their policy within the law. So when we talk, for example, with Dr. Poor, she does not have the authority to be able to issue a mask mandate. And so that's what our disagreement was. She does not have the authority to do it.
Would you support allowing her to have the authority? I mean, you just spoke about how policymakers need to.
Policymakers need to be able to, want to pursue their policies and be held accountable by their constituents. Then the city of Omaha can pursue, and I think I've heard a couple of the council members already talking about pursuing an ordinance. They're free to pursue an ordinance as long as they're following the rule of law. Andrew.
Governor, you had a chance to look at this Madsen case in Lincoln, the Madsen case with the bowling hole.
Yeah.
Now it'll come up today in the civil court. What's your impression of this and how Lincoln is handling this? And is this one of the problems that why you think the mask mandate has a problem?
Well, with regard to the bowling alley case here, I actually haven't really been following it that much other than just kind of what I've read in the paper, so I don't really know all the details with regard to that. And, but it is one of the things that, again, if you're looking to get voluntary compliance, that's why you want to ask people and explain why they're doing the right things. And that's what the approach we've taken at the state to be able to do that.
Well, what happens if you don't get that voluntary compliance?
Well, again, if you don't have voluntary compliance, then, for example, if you're going to a store, go to a different store, right? If you see that you walk into a store and people aren't wearing masks and that makes you uncomfortable, then you've got the choice to go to another store.
But doesn't that give some businesses an advantage, because they can have as many people as they want to, doing whatever they want to in a business?
So the question is, does that give some business advantages? Actually, if people are walking out on your store, that's not an advantage, Andrew. If people are leaving your store because they don't feel safe, that's not an advantage.
But it's like your smoking, thing, that people went to
Yeah, so again, I think that what we want is to really focus on people to do the right thing, help educate them about why you want to use a mask and when you want to use a mask, and get their voluntary compliance, because folks, there may never be a vaccine. We may never have one. We're working right now, we talked about how you can sign up for those vaccine trials, but we don't know that they're going to be successful, and if they are, they're certainly not going to, well, probably not going to be available at least this year, which means we've got months more that we've got to continue to manage the virus. And that's why we need people to understand why they use a mask, when they use a mask, and do it in a way that becomes an everyday part of their life, and not create, some of the resistance we've seen here in Lincoln to mandates. Oh, hold on a second. Okay, Brandon, then I'll come to you, Paul.
The Big Ten made the announcement of Huskers and conference football schedule in Nebraska's first home games in 5 weeks. Currently, the Directed Health measure allows for 10,000 people. Based on the data you've seen, can you envision what it might look like and how many people may or may not be allowed at Memorial Stadium on September 12th?
So the question was, first home game, September 12th, what will that look like? Right now, I think it's still, since as you mentioned, still 5 weeks away, a little bit too early to be able to tell, but we'll work with the University of Nebraska, and we'll work with, Pat Lopez, the interim director of public health here in Lincoln, to be able to craft a plan. So part of our directed health measures are that if you're going to have one of those big venues, right, you have to have a plan. And so we'll work with the University of Nebraska and the Lincoln Lancaster Public Health Department to craft that plan.
Would you be cool with giving up your seat?
Would I be cool with giving up my seat? Well, I'll work with the university with regard to how they're going to decide, and I'll be treated just like everybody else. Paul?
I was curious, you said we're ramping up contact tracing. How many contact tracers are being employed by the state right now?
So we have 218 that are the contact tracers at the local public health departments, and a total of 959 total contact tracers. So if you subtract, that are trained, I should say. So if you subtract the 218 from the 959, and I don't know what that, I'm not going to do the math for you right offhand, but that would be the difference of how many we've trained at the state level. Now that does include, for example, about 280 of our state teammates in the Department of Health and Human Services who are trained but are not currently doing contact tracing because we just don't have the demand right now for it. So, but they're trained and ready to be able to surge in that capacity. We've got, I think, about 400 people right now that are trained through, it's either 300 or 400 people that are trained right now through a company called PRC, and this is the company that Douglas County is primarily using. We also have Emeritus, and we're also looking at, and I can't remember how many people they've got trained up, I just don't have the numbers in front of me offhand. But we are looking to make sure that we've got that, eventually get to the point where we've got 1,000 people trained at the state level.
So, I mean, you're ramping it up by getting more people trained.
Getting more people trained, and then bringing on companies to be able to supply those trained people to us so that if we need to surge up in capacity, we've got the ability to do that.
So it's not really a surge of more contact tracers, right?
Right now, we don't have the demand for those contact tracers, so we don't actually need them to be employed doing contact tracing because we've got sufficient resources. I think there's about 400 total contact tracers that are working right now, but we want to have the capacity to be able to take that up, and that's why we're working with these different companies. Yeah, Andrew.
Going back to seriously on the seating though, do you think fans would be willing to give up their seats if they just allowed students to go to the games?
Do I think fans would give up their seats to be able to allow students to go see the games? Again, we'll work with the University of Nebraska on their plan. Nobody has talked to me about what that plan would look like, who, giving up your seats. The one thing I would say, though, is that as we get to the plan, and we're going to have people in the stadium there, everybody should use their own discretion about using their tickets. So, for example, if you are older with those underlying healthcare conditions, I would recommend that you give your ticket to your nephew or somebody else and you not go to the game, right? Exercise that judgment about your own personal health, and you'll know your health better than anybody else. So that if you feel that you've got, an underlying healthcare condition that would put you at greater risk, that might be an opportunity to give your tickets to somebody else.
I'm just curious, have you ever been tested for coronavirus?
I've been tested 3 times, yes. Yep.
All negative?
All negative, all 3 times.
Then why were you tested?
So for example, the last one, we were gonna go visit family, and so I got tested just ahead of time because I wanted to make sure I didn't have it so that everybody in the family would feel comfortable that, in fact, everybody in the family got tested, so for a family get-together, so that we'd all feel comfortable getting together.
All through Test Nebraska or somewhere else?
I got tested through Test Nebraska. I've got relatives in other states that got tested different ways. But me and my family got tested through Test Nebraska. All right, any other questions?
Cubs?
What about the Cubs? Best record in the NL. Beat Kansas City yesterday in a close one, huh?
Could they play lower rated teams in Kansas City?
So Paul is questioning the Cubs' schedule right now, I think is what you're scheduling, right? You're questioning the good record with the quality of the schedule. You know, we'll find out. We'll find out.
You know, I haven't heard very much, positive press in the Cubs organization. How have they been able to manage that? Have you heard at all?
So the question was actually about the Cubs, and has anybody tested positive in the Cubs organization? And I would have to refer you to the Cubs because I have not paid that close attention to it. All right, folks. Well, again, thank you very much. Appreciate it. I want to again thank all the folks who have been working so hard to slow the spread of coronavirus here in our state. Appreciate all the sacrifices you've made. Please continue to remember, keep that 6 foot of social distance when you go out in public. Wear a mask if you're going to the store. If you can't keep that 6 feet between you and somebody else, especially if you're going to be inside. Wash your hands often, 20 seconds at a time. And if you see a crowded bar or restaurant, it's a good opportunity to pick another bar or restaurant to go to. Also want to thank and congratulate our Developing Youth Talent Initiative award winners from Newport, Klaus, and Kawasaki. Thank you very much for your participation with our schools to be able to give our young people an opportunity to be able to see what those careers are like. And then, of course, thank you to the American Red Cross for all the great work you do. And again, remind people that you can donate. If you've had coronavirus and you've recovered, you can donate your plasma. That will help somebody else recover. And of course, if you go to coronaviruspreventionnetwork.org, you can sign up to do some of the vaccine trials. 2 great ways that you can continue to fight the spread of coronavirus here in Nebraska. Thank you all very much, and we'll see you next Monday. Have a good one.